Hello, I'm Tara Morse, the Executive Director of Indiana 211. Thank you again for having me this afternoon. I appreciate the opportunity to share everything we're doing at Indiana 211 and to talk about our transition. And I think this has been a really exciting time for 211. There have been a lot of opportunities for us to expand our services. And I have had 25 years experience with the Family and Social Services Administration in multiple capacities. So it's been really exciting to have that behind the scenes understanding of how the agency works and also bring in a new entity, which has just been really effective. And so I'm really excited to talk to you today about Indiana 211, the way we are today in 2021.
So 211 started 20 years ago, and it has been a really important part of Indiana's culture and connecting people to needed resources at the right time. Over the last 20 years, 211 has been at various levels of engagement with the communities, depending on where it was located throughout the state, mostly supported by the United Way organizations. So we are so grateful to the foundations that the United Way organizations established with 211. Through legislation, 211 became part of the state government under the Indiana Family and Social Services Administration in January of 2020. So what I'd like to do is just tell you about what 211 has evolved into and make sure that everyone is aware of how 211 works. Our agenda for today is the 211 overview. Really kind of what 211 is. I'm sure most of you are familiar, but maybe not. So I just want to make sure that it's clear and people have an understanding of what 211 is. Our transition to FSSA, our vision, mission, and values, our 5 lines of business, our collaboration, our data, and our connections. So what is 211? 211 is a free service that connects Hoosiers with help and answers from thousands of health and human service agencies and resources right in their local communities, quickly, easily, and confidentially. So essentially, when someone calls 211, based on their zip code, we can identify very quickly what resources might be available for the type of need that they have. And that's really what 211 is all about, is connecting people to the needed resources at the time that they call. There are 3 easy ways to access 211. You can call 211, or there's a long code number, which is 1-866-211-9966. And sometimes we find that phone systems drive whether or not 211 connects correctly. So the long number is always available. It's also on our website. 211 can be texted. You text your zip code to 898-211. And that automatically generates a text message with an auto response, and we can reply to those Monday through Friday, 8 to 5. We are working on enhancements to make that available in a more robust way. And then we also have in211.org, which is our website. And I'll get more into how you use the website to connect to resources later. So just real quick, some fast facts about Indiana 211. As I mentioned, Indiana 211 became the 8th division of FSSA on July 1st, 2020. We serve all residents of Indiana, and we have what we call community navigators who complete a comprehensive assessment around the social determinants of health. Now, we know that all callers sometimes don't want to participate in that, so it is always an option, and we don't want to force anyone to answer questions they're not comfortable answering. So if they are not, we move on, and we just make sure that our primary goal is to connect people to the resources they needed. And again, for some of our callers over the last year and a half, this is the first time they've needed resources. So it's really important that we don't create any barriers to success in connecting those people. So the social determinants of health are really helpful in us identifying our types of callers, parts of the state that have different needs from other parts of the state. But at the same time, this is not a required process. It's just integrated into what we do. And if a caller is not comfortable answering the questions, then we can just simply move on and make sure that we can keep them on the phone until they get connected to the right resource that they're looking for. So Indiana 211, our community navigator line, with the greatest needs being food, shelter, and utilities. And our navigators are available 24 hours a day, 7 days a week, 365 days a year. So with 211, we never take time off. This is always important to keep in mind because sometimes we do find people are really at their crisis point in the middle of the night. And so we always have navigators available to help them connect to whatever their need is, whether it be really getting a connection to the Be Well helpline, which I'll talk about in a few minutes, or maybe they need a place to sleep that night. There are lots of different things that trigger people to call, but we just want to make sure that it's clear to anyone who's learning about 211 that we are available 24/7 from a community navigator perspective. And you'll see here in a few minutes when I start talking about the lines of business, some of the lines of business are not 24 hours a day, but our community navigators are always available 24 hours a day. So one of the things that we did when we first incorporated 211 into FSSA was to come up with our vision, mission, values. So as part of a large entity, I know sometimes people can see that as now we're caught up in red tape, and we really didn't look at it that way. What we looked at this is an opportunity for us to continue what we're doing and to expand it even more, considering we are part of the largest human service delivery program in the state under FSSA. So our vision is for every Hoosier can connect to a trusted source of information and resources that supports their well-being and resilience. And that really is important. I think people sometimes think that they would never have a need for 211, or it's very specific to food, or it's very specific to shelter. But really, there are a lot of services that people, maybe their financial needs are taken care of, but there are other things that they need help getting connected with. And so 211 is here to help them find those resources that are out there. So it's really important for us that every Hoosier can connect. It's just one of our most important things that we keep in mind every day. And any barriers or any ways that we can connect in a better way, we're constantly looking at to see how we can improve that. And then our mission is to improve the quality of life for Hoosiers by promoting equity and connecting people to health and human service resources through highly skilled navigators, a robust community database, and technological innovations. And I think those three important points of navigators, so we always have to have people, we have to have that human connection. So as automated as we can make things, that human connection sometimes is really what makes the difference. So that's why our community navigators are available 24/7, 365. And then to complement that, without a robust community database, it's difficult to connect to the right resources. So I think one thing that's important to keep in mind as we're talking to different organizations who are out there helping people every day is that not every resource is always included in 211. And there's a specific reason for that. So as an AIRS accredited database, we have specific requirements for what type of resource should or should not be. And they're called our inclusion criteria. And that information can be found on our in211.org website as far as the inclusion criteria for why certain resources are included and why certain others aren't. So I want to make sure that that's really clear, especially when we're talking to faith-based organizations, because sometimes some faith-based organizations may be included and other times some may not. And it's not because we are ignoring certain organizations or that our data is bad. It's just sometimes the programs and the services, they must go through a certain set of requirements. And when those requirements are met, they meet the requirements to be included in the database, and other times they may not meet the specific requirements for inclusion in the database. So I think that's really important to keep in mind, is just because you can't find a resource does not mean that 211 resource data is not good. It just may not fit the inclusion criteria. And then also our technological innovations. And to me, this is where we have huge value as being part of FSSA, because we have access to a lot of different opportunities to look at our technology and to figure out how are things working, how can they work better. As I mentioned with our text capability, what is it that we can do with our texting capability to better reach people, especially when we know some of our younger generations, maybe texting is the thing that they're the most comfortable with. So sometimes maybe making a phone call for some generations or for some people, that's a more comfortable thing for people to do. But in other situations, being able to communicate via text is really important. We've had situations, real life circumstances where texting vaccine was the only way an individual was able to get the help they needed. For example, we had a situation with a domestic violence where it wasn't safe for somebody to talk on the phone and talk about what their needs were, but we were able to communicate with an individual via text messaging to get them connected to a shelter that we could then make contact with that shelter and get them the help that they needed and some of those wraparound services that they could get connected to, and we could text the information to them so that it kept them safe in the environment they were in, but they were still able to access what they needed without making a phone call. So that to us is really important. And then our values: respect, integrity, person-centered, knowledgeable, and innovation. And again, I think all those are pretty obvious why those would be really important to us. But as we came up with our vision, mission, values, we pulled from our resources out in the community who had been close partner advocates of 211, understood how they functioned in different parts of the state, in different community situations. And that was our group of people that we pulled together to help us develop our vision, mission, and values. So I think that's important to keep in mind, that we did have representation from a lot of different organizations, because again, we are representing every Hoosier, not just people who qualify for specific services within FSSA, but we really do want to make sure that every Hoosier can connect to us. Next is I wanted to talk a little bit about our lines of business. And I think this is really important to keep in mind, because when you call 211, we have expanded so much over the last year with our vaccine line and with our Be Well Indiana crisis counseling program. So you call 211, but there's multiple paths into getting help. And so our community navigators, I say, they are the core of what we do. And that is really getting people connected to the resources that they need. So they are just a critical piece of 211. However, we've seen over the last year that there have been other needs where maybe our community navigators don't necessarily need to be the people that someone is talking to when they call, but that we can have other people trained in a specific area that can connect people to resources a different way. So through the Department of Health, we have taken on the COVID-19 public line. So this is the line where when you call 211 and you have COVID-related questions, you go to this line, and it's staffed by a group managed by the Department of Health, and it's really answering questions about testing. Where do I go to get tested? I can't find my test results. I need to know if I'm positive or negative, and it's been a couple of days. Or I can't find my vaccine certificate. I can't seem to find it online. How do I get it? Those are the types of questions that we get on the Department of Health COVID-19 public line. And we are seeing an increase in the need for that right now as we're seeing things increase with the spread of COVID-19 at this time. And then our COVID-19 vaccine information and scheduling line. This is where we were able to stand up a new line where, as the governor mentioned, it's as easy as calling 211, where 211 became an easy way in for people to remember. I can call 211 and I can get help. And so we were able to stand this line up pretty quickly. And at one point during the peak of our vaccination, we had over 1,100 agents answering calls. And you'd be surprised, half of the calls are really about information about the vaccine, about the safety, efficacy. So we had a really robust FAQ that was developed by the Department of Health and some other academics within our community who were able to continuously add to it and update it. And it's actually still updated daily as we speak, to make sure that we are giving out the most up-to-date information and that it is coming from a source of truth, which is the Department of Health. And so we're really excited that we were able to be part of that and that we were able to expand 211 in such a meaningful way at the right time. And also scheduling. Obviously, that became a big part of scheduling initial appointments. Individuals were not able to reschedule through the state system, so we were able to help people reschedule their appointments as well. So we took over 1 million calls in the first 3.5 months on the COVID-19 vaccine information and scheduling line. So I bring that up because I think it's important to keep in mind that, as we see new programs, as we see a need, we are learning how we can support that need within our community. Another example of that is the Indiana Housing and Community Development Authority. They came to us, in the midst of the vaccine rollout and said, we have this emergency rental assistance program with a lot of funding available for people who have not been able to pay their rent for the last, 10 months and are not sure they're going to be able to pay it for 3 months going forward. And so we stood up another line where people can call and get help answering or filling out the application for the Emergency Rental Assistance Program. And so we were really excited about the opportunity to partner with the IHCDA and stand that up, where we had another 50 agents who were taking calls and still are today to answer questions and to help people figure out what they need to do to apply. And then our last big area is our substance use disorder and mental health. And when you call 211, this is kind of the first option that you'll hear. And when you select this option, you get the option for the open beds, LIFT, the Peer Recovery Network, and Be Well Indiana. So those all fall under the Division of Mental Health and Addiction kind of management from a business perspective. But 211 is able to take those calls, and our community navigators actually work with open beds and LIFT and are able to get people rides to their treatment, or through open beds if somebody is already in a facility and is going to need some wraparound services. We can work with a referral to get those people connected to additional resources that they might need once they are no longer in their facility. And then our peer recovery network, we know from, experience and data shows that you have a much higher success rate when you can connect people who are recovering with other people who have been in recovery. So we're really excited about the fact that 211 is kind of the avenue into that option. And then, of course, the Be Well Indiana line, which is our crisis counseling program that was really created kind of as a result of COVID and all the mental health issues that they were feeling isolated, worried, not sure what was going to happen. And so again, our Be Well Indiana line through 211 is available 24 hours a day, 7 days a week, 365 days a year. And we know that line will continue on for the next 2 years at least. So we're really excited about having that as an option under 211 as well. So I just wanted to really go through all that. I know it's a lot of detail, but I think it's really important to understand that 211 has a lot going on. And so we really count on our partners in the community to get the word out, because we know you are working with people every day. Sometimes, there are food pantries and things available, but yet there might be some other needs that maybe some of our faith-based community organizations don't have access to. But through 211, we can help you complement what it is you're already doing and then add to that. So I just wanted to make sure we were clear on all the things that we're doing, and we do have more things in the works coming soon. So again, I'll talk a little bit about collaboration. I think I've mentioned that. You can see that through our rental assistance program, our Be Well Indiana. Again, that's one of our sister divisions, which is the Division of Mental Health and Addiction. And then our COVID-19 public information line. And again, that's through the Department of Health. So we're working with other agencies, we're working with other divisions, and it is really important to figure out how do we help people get connected. So some of the government programs that we work with, so right now when someone has a concern about the treatment of an adult protective services, those calls come into 211. They go into a specific queue, and we have our community navigators actually take those, and they are able to fill out the necessary information to make that report that then is managed through the Division of Aging. Again, another really important resource and service that's provided by the community navigators. And then, as I mentioned, our Division of Mental Health and Addiction and Department of Health and Indiana Housing Community and Development Authority. So we are looking at other opportunities with other divisions. I'd like to talk a little bit about data. So as we know with any organization, to look at kind of your effectiveness or what you should be doing or where you should be going, data is always really important. And so we can use data to inform, how are we doing? What are we doing? Where is the need? What is the need? And so we're really proud of what we released in June of 2021, and that's our Indiana 211 data dashboard. So if you go to in211.org and select Indiana 211 data dashboard, you'll see this little button here on the screen. And when you click that, you'll go into what is our data dashboard. So here's just kind of a snippet of what you would see. So you can see that we have aggregated client data, so we don't have any details about people, but it's enough information that we can see who is calling, what are the top needs they identify. We can filter it by dates, by county, by demographics to to provide multiple views of the data. So this is a really dynamic dashboard, and it is updated weekly, usually on Tuesday mornings. So that would be adding data for the previous week. So you can see it defaults here to all of the data we have, and starting in January of 2020 is that's what our starting point was for this data. So we were able to take the data in through our FSSA data and analytics team, and then they were able through this Tableau dashboard to present the data in such a way that a lot of different users, agencies can look at this and see who is it that we're serving. Is the need changing? We definitely see throughout the state, if you have an opportunity to go in here and click around a little bit, you can see that the data changes depending on where you live in the state. So sometimes, what's a need in northern Indiana might be a little bit different than what the top needs are in other parts of the state. And then the other tab, you can see that we were on the client data. And if you look up here at the top, the referral data, this is, the types of referrals. And so it's aggregated referral data that provides information about where referrals are going and the top needs and unmet needs. And I think the unmet needs is something that a lot of organizations are interested in is what is it that people are calling about that we can't provide that need for them. They might think that they have a need, but when we look at, their current situation, they don't qualify for the programs that are available for that particular need. So again, that's another area where I know a lot of organizations like to take a look and see what that unmet need is, and through some creative process, they might be able to come up with ideas or ways within their community to really address that unmet need and to figure out how they can meet it, or what some next steps could be. Our online resource for help is, again, you go to in211.org. That's our landing spot for everything related to 211. And then you would select the Find Help option to connect to resources online. So this is another tool that it will connect to that was part of the FSSA toolbox when FSSA or 211 became part of FSSA. And so we are currently working to refine it and to make sure that when there's a connection that what you search for, that you'll get what's expected. So some important things to remember. It's called Indiana 211 Connect, and it is really powered by our Indiana 211 database. So even though it looks very slick and it's got a lot of different options and there's tiles and programs that you can pick on, behind the scenes, everything that you're accessing is exactly what the community navigators access to. So it's just a different avenue, a different tool to get into resources that people can use to self-serve, or as organizations who are working with individuals in the community, it's a free resource for anyone to use. So we want to encourage people to use it, to provide feedback. So I'll show you a little bit about just a couple screenshots about all that's available. So on our homepage, there's 4 ways to explore resources. So there's the search bar that you can allows you to search for keywords. There's the browse by category, browse by resource providers, and then you can take needs assessments. So we have a lot of different ways that you can tap into resources depending on what your need is. So again, we're really excited about this tool. Again, it's a Salesforce based platform, and it is very powerful, and we are continuously working to refine it. We are looking at different categories. We just went through a big assessment of our youth services and what was available, and we're looking at our older population services right now. And so there are definitely different lenses into the data, different ways to look at it and access it. And so we are really working hard every day to continue refining it, and this is an iterative process, so it will take us time. And as we add more resources, we always want to make sure, are they connecting the way that we expect them to within the tool? So we're really excited about that. And then this is something that's a little bit unique that we have not had before. You can pull up a resource that looks like it's something that would be really good for you, and the information displays very nicely. You can send it to yourself or to someone you're trying to help, and send that resource out to them via email or text message, so they have all the information on their phone or in their email, and then they can contact that entity directly. It's a very easy to use tool. There's a lot of information. I think that's sometimes where it becomes a bit of a challenge, just because there's so much information, and displaying it in a meaningful way so that people can access what they need and find things when they need it. We're continuously working to figure out how we do that best. And so one of the things this tool provides is for community partners, such as resources, to join this 211 Connect. And what that would do is it will allow you to create an account. And once you create an account, then if an individual is referred to your entity, you can actually see that referral. And then you can proactively make an outbound communication to that individual, because sometimes what we find is someone finds 10 connections to different resources, but they may not follow up. And so if they haven't followed up, it gives the community partner an opportunity to follow up with that individual. So we're excited about that as it grows. And again, we're working with different entities and getting feedback on what's working, what's not, so that we can continually improve it. And then if you have a resource that you'd like to suggest, you can suggest a resource or an organization that is not listed. And like I said, we do have parameters about our organizations and who's included and who is not, just because of our inclusion criteria. And so I think that's important to keep in mind, but we are open to suggestions for resources because there are so many out there. We have a whole resource curator team who that's their full-time job, is to verify resources, to follow up, to identify if a resource meets the inclusion criteria. So we have a whole team dedicated just to that task right there. So it is very important with any 211 that the resource information is as up to date as possible. If you have questions about 211 Connect and where to start, we have a pretty expansive FAQ link at the bottom of the homepage. Get questions answered. We also have opportunity to call 211, or we just want to make this accessible for people. We don't want people to be frustrated, but we do know there are a lot of people that are out there and are able to use the internet, and that's where they're more comfortable. So if that's the case and they don't want to pick up the phone and call, we need to make sure that they can get the information, that they can access the information. And then for the community partners who sign up as a community partner, they then also see that information, and we can make that more of a closed loop referral where entity A gets a referral and can actually reach out to person A who appears to have a need and connect the two. I'm happy for anyone to contact me with ideas, suggestions, any room for improvement, positive, negative experiences, because it's only in those experiences that we can learn what we're doing well, but more importantly, where can we improve? And that's our goal. We are not going to be a stagnant entity. We are going to continue to improve, and we're going to continue to expand on that great foundation that's been laid out over the last 20 years.
Again, thank you for your time today and listening to all the things we have going on at Indiana 211. We want to remind you that there are 3 easy ways to contact 211. You can simply call 211 from any phone. You can dial 1-866-211-9966. You can find us online at in211.org, or you can text us at 898-211. Any of those ways are really easy ways to contact us, and we hope that you share this information with all the individuals that you're working with to help people get connected to the services that they need when they need them.